The use of least restrictive and punishment procedures in behavior analysis therapy. Overview of least restrictive procedures and aversive treatment. An individual receiving behavior analysis therapy is protected by rules and guidelines that are put in place to ensure they are receiving the best possible treatment by qualified behavior therapists. Clients also have rights guaranteed to them. One of these rights is access to effective behavioral treatment. Effective treatment would include the client having access to procedures that would be considered the least restrictive. The right to least restrictive procedures goes along with the many considerations regarding punishment procedures and aversive treatments. Introduction to the least restrictive procedures and punishment, timeouts. Least restrictive procedure is the idea that an individual has the right to live, work, play, learn, and receive services in the environment that is the least restrictive. If you have an individual receiving behavioral analysis therapy, they should be obtaining these services somewhere that has contexts that are as free as possible of unnecessary limits on their freedoms and rights. Implementing punishment procedures to handle misbehavior in a client may be a direct infringement upon these rights. One type of punishment that may result in removing an individual from their least restrictive environment is a timeout. The goal of a timeout is to decrease the future occurrence of a specific behavior. The type of timeout that would remove a child from their environment, resulting in them having unnecessary limits on their freedoms, would be an exclusionary timeout. The history of least restrictive and punishment procedures. Least restrictive procedures and environments is not the only right an individual has when receiving treatments. Researchers explain that different rights an individual is entitled to are a therapeutic environment, services whose overriding goal is personal welfare, treatment by a competent behavior analyst, programs that teach functional skills, behavioral assessment and ongoing evaluation, and the most effective treatments available. These rights were put in place because it was shown that when following these guidelines, new behaviors were developed in lieu of problem behaviors. An individual having a right to a therapeutic environment means that the environment is safe and humane. It has teachers and caregivers that are present and capable of providing necessary instruction and care. A therapeutic environment presents the fewest restrictions necessary while still allowing the individual to learn and develop. This means the individual has freedom of movement and access to preferred activities. Due to the highly controversial nature of exclusionary timeouts, laws were put into place to regulate exclusionary timeouts. This means there are regulations on room size, type of door, type of locking mechanism, amount of time a child can be in an exclusionary timeout, and regulations on how adults need to monitor the child in a timeout. Ethical issues with least restrictive and punishment timeout procedures. There are many strategies that exist to help manage problem behaviors. Punishment procedures such as exclusionary timeouts should not be used as the first option when implementing a behavior plan. Appropriate steps need to be taken to implement reinforcement strategies before turning to a punishment plan. These procedures can become an ethical issue quickly. If a child is being sent to an exclusionary timeout multiple times a day, they are missing out on instructional time during their day. This also means that they are being removed from their least restrictive environment. Exclusionary timeouts do not teach children emotional regulation. When an emotional or misbehaving child is sent to a timeout and expected to calm down on their own, they are not going to learn how to regulate their emotions independently. When children with disabilities cannot communicate effectively with words and they are placed in an exclusionary timeout, nothing is getting accomplished in regards to that child learning how to handle themselves the next time. Teacher or staff members must issue a warning before placing the child in timeout, as well as offering a brief verbal explanation as to why the child is being removed from the classroom and put into the exclusionary timeout. Many times, teachers and staff members issue a timeout without warning or the brief verbal reasoning. If teachers and caregivers are removing a child from the classroom, which is already deemed the least restrictive environment, and placing them in an environment limiting their freedoms and access to preferred activities, we are out of compliance with the code, which creates an ethical concern. It is important for board-certified behavioral analysts, or BCBAs, to be aware of the ethical issues connected with least restrictive and punishment procedures. There are many things that you can implement first before a professional should turn to timeouts. Benefits of punishment procedures. Exclusionary timeouts are not the only type of timeout to exist. Timeouts from reinforcement does not involve removing a child from their least restrictive environment, so it is more ethical because it is not as intrusive. It is simply denying a child a reinforcer for a period of time, however they are still in the same environment as their peers. When used in accordance to strict and predetermined criteria, timeouts can be used without harm to the child. If a child is presenting a danger to him or herself or others, the best place for them may be in a room outside of the classroom. Timeouts allow children to have the opportunity to calm down and think about what happened. It also allows them to return to the group after a short amount of time when they are following the expectations again. When paired with other behavioral strategies, timeouts can be an effective tool in behavior management. However, when paired, the timeout still should not be the main part of the behavior plan. Disadvantages of punishment procedures. Teachers, parents, caregivers may abuse timeouts. They may want to break from the child with the problem behaviors, so they send them to the timeout, removing them from the least restrictive environment. The adults in this situation will then use this time as a break, instead of an appropriate behavioral management strategy. Another disadvantage is that some children may want to get out of the classroom, so they purposely exhibit behaviors they know they will get them sent out. After being sent out 1 or 2 times, a child knows what to do to get the free pass out of class again. When timeouts are used too frequently, learning time is lost in the classroom. They are no longer receiving instructional time because they are removed so often. Some children react negatively when being told to go to timeout, so they may become more aggressive than when the situation first started. Proper use of punishment in regards to least restrictive procedures. Guidelines have been put into place in order to ensure individuals are receiving the least restrictive alternative and that punishment procedures such as timeouts are not being abused. All individuals are guaranteed personal liberties. In the field of applied behavior analysis, or ABA, one of these liberties or rights given to the clients is the right to a therapeutic environment. As previously mentioned, this means an individual is guaranteed the right to an environment that presents the fewest restrictions and limitations while still giving them an environment to develop and learn in. It means the individual has the freedom of movement and the freedom to preferred reinforcers. One thing that may infringe upon this right is the punishment procedure of exclusionary timeouts. When a child is removed from their current environment, which has already been deemed least restrictive, and placed in a room for an exclusionary timeout, they are losing freedom and access to preferred reinforcers. If a timeout is deemed necessary, steps need to be followed before it can become part of the official plan. A BCBA needs to look at all the past attempted treatments and see if they were successful or not. They also need to understand why or why not these previous attempts were successful. They also need to conduct a functional analysis to determine the function of the problem behavior. They should work to develop a replacement behavior that could be more appropriate. They also must attempt less intrusive treatment options first. The future of timeouts and least restrictive procedures. It is important and required for children to be given the opportunity to learn in the least restrictive environment. As research and legislature has shown, least restrictive procedures must be considered before using more intrusive behaviors or approaches. BCBAs, teachers, caregivers should collaborate with other professionals if they feel they cannot come up with a less intrusive approach. If timeouts are being used, professionals should start with the least restrictive ones before removing a child from their therapeutic environment. One procedure that is becoming more popular is Positive Behavior Systems, or PBS. This strategy has been implemented in many schools. However, it is not well known by every school and school official. Using prevention-oriented approaches may decrease problem behaviors before they occur. BCBAs may consider using a similar approach when constructing behavior plans. PBS has been successful in the schools that have fully and consistently implemented it. In the future, using approaches similar to this could reduce the amount of timeouts given to children.